to talk really quickly about the psychological services for survivors that we have here on campus. Of all categories of trauma, sexual assault confers the highest risk for post-traumatic stress disorder. And we know that 64% of women who experience recurrent partner violence report the development of post-traumatic stress disorder. So while many individuals are resilient, many individuals are not and are in need of follow-up psychological care in the aftermath of violence or assault. PTSD can present alone, or it can present in combination with depression, anxiety, substance abuse. And there's a whole bunch of people who don't develop PTSD but develop, again, depression, anxiety, substance abuse without PTSD. So many survivors of assault and violence are in need of kind of follow-up psychological care. So on campus, one of the you can see my last bullet point, when in doubt, refer to CCS. Counseling and Consultation Services, CCS, formerly CSDC, is at the corner of Normal and Lucinda. The number is right there. CCS provides a lot of different services. They offer free confidential counseling to students, predominantly in a short-term care framework. So 6 to 8 sessions is typical, but it ranges between 12 and 14. But very important for our discussion today also is that they offer walk-in services for students who are in immediate distress, and they have a 24-hour emergency line for after-hours crises. So students who call the public safety line can actually leave their information and have a counselor call them back. Now, one problem with that is when a student calls in the middle of the night at 3 a.m., the person who picks up the phone says NIU police, right? So for some survivors, they might be like, that's not who I really want to be talking to, right? Again, when in doubt, refer to CCS. They, again, offer counseling. They have the infrastructure for handling immediate distress, and they have the 24-hour emergency line. Another confidential service on campus is through the Trauma Services Clinic in the Psychological Services Center. Gosh, thank you, Erin, she works there. And this is the clinic that I am the co-director of. It's a ground floor annex of the Psychology Computer Science building. You can see our information there. What we do in the Trauma Services Clinic is trauma-focused treatment. So Dr. Holly Orcutt and I have both been trained by the Veterans Administration in doing empirically supported trauma-focused care for trauma survivors. Our treatments typically span 10 to 20 sessions, and we offer a free 2-session diagnostic evaluation for folks in the community, but of course for students, this service is free. And then we do follow-up intervention on an as-needed basis, and those cases are supervised by myself and Dr. Orcutt. But we do not have a 24-hour service. So for students who are in immediate distress, this is not where you would send them. We sometimes have some people around who might be able to talk with student in distress, but that's not even always the case. So when in doubt, if you have a student in distress, send them to CCS. There are 2 other counseling centers on campus that I want to touch on briefly. There's the CCTC, you're going to be tired of all these acronyms by the end. Community Counseling Training Center in Graham Hall, also free confidential counseling. This is through the Counseling Adult and Higher Ed area of the Department of Education. They offer things that are more along the lines of relaxation techniques, self-esteem building, communication and relational skills, and they offer both individual and relationship counseling. And then there's also the Couple and Family, the CFTC, the Couple and Family Therapy Clinic in Wirtz Hall. It offers interventions for individuals, couples, and families, predominantly from a family systems perspective. So they're really focusing on families and couples, struggling with a number of different issues that trauma can also affect. And it has a sliding scale payment, but they also state that clients are not turned away due to the inability to pay. So this is part of the FCNS program and the Graduate Specialization in Marriage and Family Therapy.